Sometime in the next few weeks, about 2.9 million Americans are going to open a letter from their insurance company and find out their Medicare Advantage plan will not exist next year. If that letter shows up in your mailbox, there is a 63-day window that opens the moment you read it. Most people never hear about it. And when it closes, one of your options, a good one, closes with it. And it does not come back. I'll tell you exactly what that window is in a few minutes. But first, let's make sure you know what to do the day the letter arrives. I'm Ray. On this channel I break down retirement money decisions in plain English. No jargon. No sales pitch. Today, 3 things. What that letter actually means. The 3 dates that decide your coverage for all of next year. And the one right you have that nobody at the insurance company is going to volunteer. Stay with me because the third one is worth real money. And it's the one people miss. Here's what's going on. Insurance companies have been pulling out of Medicare Advantage markets. Not because you did anything. And not because Medicare is going away. Because those plans stopped being profitable for them in certain counties. This already happened once. About 2.6 million people were pushed off their plans going into 2026. And it's happening again, bigger, for 2027. The numbers this round. Roughly 1 in 10 Medicare Advantage enrollees are facing forced disenrollment. In 12 states, it's more than 1 in 5. In Vermont, it's the overwhelming majority of people on those plans. Humana alone is projected to affect about 600,000 members with targeted plan exits. Presbyterian Health Plan is leaving most of its markets. Clear Spring Health shut its Medicare Advantage operation down entirely. So if you get this letter, you're not being singled out. You're one of millions. But you are on a clock. And the clock does not care whether you understood the letter. Now, the letter itself. Every Medicare Advantage and Part D plan is required to mail you an annual notice of change, the ANOC, by September 30th. That's the deadline. And if your plan is being discontinued, you'll also get a separate non-renewal notice. Here's the part one want you to hear. These letters do not look urgent. They come in a plain envelope. They're 20-some pages. And the important sentence is buried. So do this. When mail from your plan arrives this month or next, do not set it on the counter. Open it. And look for one of 2 things. The words, will not be offered. Or the words, non-renewal. If either one is in there, your plan ends December 31st. And if you throw that envelope away without reading it, you still lose the plan. The letter is not what cancels it. All right. 3 dates. Write these down. Date 1. October 15th. That's when Medicare Open Enrollment starts. From October 15th to December 7th, you can pick a different Medicare Advantage plan, pick up a standalone Part D drug plan, or go back to original Medicare. Whatever you choose in that window starts January 1st. Date 2. December 7th. That's the end of open enrollment. This is the date most people should be aiming at. Decide before December 7th and your new coverage starts clean on January 1st. No gap. Date 3. December 8th. This one is your safety net. Because your plan is being discontinued, not because you changed your mind, Medicare gives you a special enrollment period. It runs from December 8th through the last day of February. So if December 7th comes and goes and you froze up, you are not stranded. You still have until the end of February. But understand the trade-off. If you use the safety net instead of the main window, there can be a gap between when your old plan ends and your new one starts. So the safety net is a safety net. It is not the plan. And if you do absolutely nothing? On January 1st you go back to original Medicare. Part A and Part B. You'll still have hospital and doctor coverage. But you will have no drug coverage at all unless you choose a Part D plan yourself. Nobody enrolls you automatically. Now, the thing I promised you at the top. When your Medicare Advantage plan terminates or leaves your area, federal law gives you what's called a guaranteed issue right to buy a Medicare supplement policy. Medigap. Guaranteed issue means this. The insurance company must sell you the policy. They cannot turn you down for your health history. They cannot charge you more because of your diabetes, your heart condition, your cancer history. They have to take you. And that right lasts 63 days after your Medicare Advantage coverage ends. Why does that matter so much? Because outside of a guaranteed issue window, in most states, a Medigap company can medically underwrite you. They can look at your health. And they can say no. For a lot of people in their 70s and 80s, that no is permanent. Once you've been in Medicare Advantage for years, this may be the only realistic chance you get to move to Original Medicare plus a supplement. 2 honest caveats. Federal guaranteed issue rights after a non-renewal are narrow. They generally cover Medigap plans A, B, C, D, F and G. And Plans C and F are only available if you were eligible for Medicare before January 1, 2020. Some states are more generous than that federal floor. So this is worth one phone call to confirm for your state. Is Medigap right for everyone? No. It costs more every month than a zero premium Advantage plan. And you'd add a separate Part D drug plan on top. For some people, a different Advantage plan is the better answer. But you should make that choice on purpose. Not lose it by default because nobody told you the window existed. So here's your checklist. 1. Watch the mail through the end of September. Open anything from your plan. Look for will not be offered or non-renewal. 2. If your plan is ending, write down your prescriptions and your doctors on one sheet of paper. Every drug. Every dose. Every doctor you actually want to keep. You cannot compare plans without that sheet. 3. Starting October 15th, use the official Medicare Plan Finder at medicare.gov. Type in your drug list. It'll show you what each plan in your county will actually cost you next year. Not the advertised premium. The real number. 4. Before you settle on another Advantage plan, at least price a Medigap policy while your guaranteed issue right is open. Get the number. Then decide. 5. Get free, unbiased help. Every state has a SHIP, State Health Insurance Assistance Program. Trained counselors who do not sell anything and do not earn commission. Call 1-800-MEDICARE and ask for your state's SHIP. That call is free. And it's the single best hour you can spend this fall. If this helped, subscribe. I put one of these out every few days. An open enrollment season is when the expensive mistakes happen. And do me a favor. In the comments, tell me one thing. Has your plan sent you a non-renewal letter yet, and what state are you in? I read every comment. And it helps me see which states are getting hit hardest so I can cover them next. Take care of yourself. And open your mail.